It's been 1 year, 3 months, and about 6 days since my gender confirming surgery, and I have an update. Yay! Um, I have my revision surgery scheduled. I finally was able to get it scheduled. Just have to get a few things done because after they talked to the doctors with all the notes I gave them, what's going on, what possibly could be the reason why needing it, and what they need to know. The doctor said I don't need to go and see them. They just added it all to their notes, so I don't have to see anyone beforehand. They just want me to get a letter from my therapist, one letter, and just to make sure, with the letter basically saying that I need this for my dysphoria and whatnot, that it's medically necessary, just in case the insurance decides not to cover on the basis on cosmetic only, when it really isn't cosmetic because, well, for me, where my labia majora is practically non-existent. It's only like a thin sliver where it's just like it does not even be there. So if that's not filled in, it's going to cause dysphoria, which it has a little bit already. So yeah. Um Other than that, my revision is next month on the 13th. I'm not sure the time just yet, but you usually don't find out the time for surgeries until the day before, pretty much, when you have to be in. And it's going to be an outpatient procedure, so yeah. For me, what's can be done from what's been discussed, what I'm wanting done the most is, number one, my labia majora filled in. So we can be doing a fat transfer from the tummy to my labia majora to fill that in. And the tissue that surrounds the urethra, how it bulges out, and how it's worse when I use the bathroom or sexually aroused in more of a sitting position, or yeah, it bulges out more. So getting that fixed, tacked down, you mentioned probably shaved down or whatever needs to be done to fix that so it doesn't bulge out anymore. Because sometimes when it bulges out, it's like where it was before surgery, my initial surgery. So, and what he was saying with the labia minora being lifted up and the labia majora being filled in, he doesn't like doing them both at the same time because instead of staying separate, usually what happens is they become like one. Instead of both labias being separate, they just end up becoming one. So he doesn't like doing them both together. So because I want my labia majora filled in the most, that's going to be done. All I know is, yes, I'll be put out for it. And I was told beforehand, the first time I see him, like 7-8 months ago, for the initial check for revision, I would have a catheter in for 5 days. So, and it's an outpatient procedure, and I will be put out for it. So, yeah. Other than that, with how everything's healing from the initial surgery, where the vaginal entrance connects to the perineum. That scar tissue that's been there is doing so much better. It's almost gone. More so on the left side than the right. The right side still has a little bit, but it's like, oh, it's like it's starting to heal really well. And the scar tissue on the right side, where the mons pubis connects to the labia majora, that area where they have to put more stitching right there. For some reason, since one of the toys I used is one of the clitoral stimulator toys that's like the air pulse with the vibration, it's been helping to heal that scar tissue in that spot. So it's doing a little bit better. Not 100% gone, but it's still there. So yeah. Other things since surgery or in the last month or so, yeah, that I've noticed. Leg hair I'm still kind of losing, but not really enough to notice much. But I have lost at least one hair that I've noticed. Like how I mentioned a long time ago, whenever I get those weird, it looks like in the hair follicle, looks like there's a black thing in it. Then when you squish it, the dead hair just falls out. I found one hair like that. So I'm still losing leg hair. I don't know if I'm going to lose all of it or not. So yeah. Last night I had a nerve reconnect, which was uncomfortable. And something I'm happy about. These wonderful things. My breasts up here. It's up here. This whole area's been feeling in, where I just been noticing it a lot when I look in the mirror. And I just last week, on Tuesday, I think it was, I looked in the mirror. I broke down, started crying a little bit, because how hard it was and how long it took to get my breasts where they're at and to be happy and comfortable with them, even though I still want up here filled in more than what it is. I'm happy with them and the results so far, and how they're a 32 G American sizing. So yeah, and I don't want them to ever go away. I don't want to have that bad dysphoria ever again. So with everything else that's going on, I've gained weight, and that's part of why this is filled in and whatnot. When I seen the doctor the last time, when they weighed me, it turns out I've gained a significant amount, more than I ever thought. Because before I was 133 pounds, and now I'm 139. So before surgery, I was 100. When my prescriptions were switched around, I lost weight, down to 116. I gained that back to 122. Then I gained to 133 pounds. Then it stayed stable at 133 for a while. Then in about 6 months, I went from 133 to 139. And um where my weight is. I'm happy um with the results it's helping with my breasts. But whatever I do, I do not want it to affect, like if I decide I want to lose some weight, which my body just looks amazing where it's at. But if I do decide to lose weight, whatever I do, I do not want it to affect my breast size. Because that's what makes me extremely happy with my body more than I can say equally the same with my genitalia and my breasts are like they're equally, but my breasts are like a number one because before surgery, that's what was causing, like before surgery, um, and before hormones, back in 2006, that's what was causing the worst dysphoria because I knew I was supposed to have gone through female puberty, like that biological instinct, and because I didn't, and I didn't have breasts at the time, it caused the worst dysphoria I ever had in my life. But as I got on hormones and time went on, and my doses got corrected and readjusted to what was going on at the time, and these got bigger and fuller, the happier and less dysphoria I had, the happier I became, less dysphoria I've have until up to that surgery. Because when the dysphoria from here went away, the dysphoria from down there started getting really bad. But then when I had surgery and everything readjusted, I got to where I'm at now and gained that one last cup size where I'm at now. My dysphoria from my breasts have 100% just gone away. The dysphoria I had because they weren't where they're supposed to be. And now they are where they're supposed to be. That dysphoria is pretty much non-existent from this area. And what dysphoria I do have is that little bit because my labia majora is not where it should be. But it hasn't been affecting me to the point where my breasts were in the past, how that caused dysphoria from not being fully grown in and filled in. So, yeah. But where everything's at now, I'm happy that they've filled in more and everything's just getting where it should be. So, what's also been going on is dilating is so much easier now, especially when I use a little bit more lubricant. It just goes in without issues. And when I last talked to him about my dilation schedule being switched so I don't have to dilate twice a day and every day for 30 minutes, which I've been doing longer than 30 minutes, and that's part of what's been helping. They just said they want me to go for a month, a whole nother month before they decide to back off on some of the dilation. So pretty much I may be dilating every day, twice a day until revision. So which is kind of frustrating, having to dilate an hour a day or more depending on how long I dilate after the 30 minutes. So, yeah. But it's worth it to not have that issue of tightness anymore. And my vaginal canal's been really sensitive, and to the point where when I put the dilator in to dilate, I feel it, and it's just like that extremeness. Like, all I can say is, like, sexual wise, it's pleasurable to a point. Non-sexual wise, it's just overwhelming a little bit. But I do feel it, but it does feel good to be able to feel that. It feels right, it feels normal. And other than that, I mentioned I was squirting when dilating. It just triggered squirting. It's still happening, but not as much. I think I kind of figured out what was causing it. The doctor was saying that let's see, the pressure from the dilator against the bladder is what could be causing that. So, just as a warning to anyone dilating, that could happen. So he just suggested to use the bathroom first to make sure the bladder's empty, which I've pretty much been doing that every single time. And when I do squirt, pretty much my bladder's empty. So I know it's not urine, even though squirting consists of that prostatic fluid, like the seminal fluid, combined with glucose and a little bit of urine. Because that's what it's made up of when you squirt. From all the research I've done and others' videos I've seen and whatnot. So, yeah, it's happening less. And I think part of it was I had the ceiling fan on every single day for almost a whole month. And that cool air hitting against my vulva, mostly my clitoris, I think could have been causing it. Or the room itself, the temperature in this room probably was a little bit colder. So the coldness against my clitoris, stimulating it that way, probably contributed to it. But other than that, I've noticed when it's warmer in the room, that hasn't been happening. So I can't confirm 100% what's making it happen, or if it's against my G-spot, or just the pressure of all of it. But there's been times where it feels like I'm gonna squirt, but I don't. But that feeling, that build up within, like that sexual build up within the clitoris you feel, and the urethra getting like closer to the, and build up and closer, kind of feels like at times it does, but then it doesn't happen. So I'm like, feels like I'm going to squirt, but I didn't. So I'm still not 100% sure if it's just a little bit of everything I mentioned or whatnot is causing that to happen. But when it does, it actually feels good to me. It feels right. I just wish sexually it would happen more than just dilating. Because when I dilate, it feels right. Toys, the real thing, whatnot, feels right. Um, and when I do squirt, whether it's sexual or dilating, it helps with my dysphoria for some weird reason when that happens. Like the mind body connection is like there, and it feels right, and it just helps with that dysphoria, I've noticed. So, yeah, I just wish I could figure out what's exactly causing it to happen so I can replicate that in more of me time or partner, fiance, to be able to replicate that to make it happen. But it is what it is. So, yeah. Other than that, um, I've noticed a little bit more fat in my face, like the cheeks through here, recently. And the rest of the body hair through here and here, down in the tummy area right here, and what's left of my underarms. Nothing's changed. So I'm gonna have to get another laser done on my underarms, treatment done, and talk to him about my face to see what can be done if I just need to go straight to electrolysis. And I do not want to have electrolysis done because I know how painful it is from having it done down there, especially if I can't get numbing. So, yeah. Other than that, there's no anything update since surgery, so no other surgical updates. So my revision's the 13th, waiting to hear from them back. They're trying to find post-op dates for me to be scheduled, and we'll just have to go from there and just see what happens when I have revision next month. So yeah, just a little that nerves that come with it, like happiness that it's actually scheduled, and a little bit nervous like I was before, which I know I'm gonna be fine. Right when I fall asleep and just wake up like the initial surgery. So until my next video, please comment, rate, and subscribe. And until then, if you have any comments or like questions, just comment and I'll see what I can do to answer it. And if there is enough of the same question, I may do a video. So yeah. So to my next video, comment, rate, and subscribe, and